Hello, my name is Restori Mishika and today I will be presenting about panic disorder. This disorder is one of the anxiety disorder and it's known for causing sudden and intense episode of fear called panic attack. So to go through this, we start by introduction to understand the panic disorder, and then we move on how common is the panic disorder, the symptom of panic attack, what causes panic disorder, treatment and management, and finally conclusion. So panic disorder is an anxiety disorder where a person experiences repeated panic attack. So what is panic attack? A panic attack is defined as a sudden episode of intense fear that comes without warning and it peaks within minutes. So people with panic disorder also develop a strong fear of having another attack, which can affect their daily lives. So, according to Harvard Health Publishing, panic disorder is a common mental health condition that is estimated to affect nearly 5% of US population. And according to American Psychiatric Association, women are more likely than men to experience anxiety disorder. So the symptom of a panic attack can be very intense and they can include a racing out heartbeat, shortness of breath, chest pain, sweating, shaking, dizziness, and the feeling of choking. And many people also feel like they are dying or losing control because these episodes can be so frightening. People often worry about having another attack. So, what caused those panic disorder? We have several reasons, such as parties and meetings, individual performance, such as giving a speech, which I struggle with. I remember the time I had to do an exam, a oral exam. I was sweating. I couldn't talk anymore. I was feeling like I was fainting, and the examiner has gave me a chair to sit down because I couldn't speak no more. And we also have another situation, objects or activity that can cause fear or anxiety, such as airplanes or needles, traumatic events such as physical or emotional trauma, reminder of memory of prior traumatic events. So how to treat those panic attack? So according to Harvard Health Publishing, we can use cognitive behavioral therapy, which is a form of psychotherapy that teaches you how coping behavior that can be used before and during a panic attack. And you can also learn how to reframe your thought and strategy that can reduce the frequency of severity of panic attack over time. We can also use antidepressant even if you don't have depression, because this medication can reduce the symptom of anxiety. And we can also use an anti-anxiety medications such as benzodiazepines, which are medication that can be taken during panic attack to rapidly improve symptoms. So to conclude, we can say that panic disorder is an issue, but it's also a highly treatable condition. And learning how to recognize the symptom and to understand how the disorder works can reduce fear and improve daily lives. So with the right treatment, people can recognize and regain control and live normally. Thank you for following my presentation. Here are my references for the presentation.